Well, as the temperatures continue to plunge to record lows and we see snowfall across the country, it is important to take care, especially when you are shoveling snow. Let's bring in Dr. Christopher Labos, epidemiologist and cardiologist, to talk a little bit more about keeping yourself safe. Doctor, thank you for joining us this morning.
Oh, my pleasure. Thank you for having me.
With this weather, with the snow, is this when we start seeing an increase in cardiac arrests?
Yeah, it is. I mean, we always see a spike in cardiac events during the winter months, and there's a few reasons for that. One of them is the extreme cold, but another one is whenever you have large snowfalls like this, people who are often usually pretty sedentary go out and do something that is surprisingly exertional. And when you talk about shoveling snow, people don't always fully appreciate how
Mhm.
much stress that puts on the heart because snow is heavy. It takes a lot of blood flow to the muscles to be able to lift that amount of snow. And the only way your heart can deliver more blood and more oxygen to your muscles is to beat faster. And when you ask it to beat faster and faster and faster, that is putting more demands on the heart. And that's why we see an increase in cardiovascular events when people do activities like this.
What can people do then to minimize that risk, and what should you be looking for when you're out shoveling snow?
Well, the one thing that you can do to minimize your risk is, don't take it in one shot. Realize that this is a very exertional thing and approach it like you would any form of exercise. So warm up a little bit beforehand and, make sure you don't have to fill your entire shovel. You can do sort of half shovels so that you're not lifting as much with each, shoveling. So try to just get half of the snow, and also take breaks. You don't have to do it in one entire shot. You don't have to clear your driveway in one sitting. You can do it in stages. Do a little bit, take a break, go back, do a little bit more. And then the important thing too is stay hydrated, because this is exertional activity. So when you go in, take a drink of water, relax, change your clothes if they've gotten sweaty, and then go back out again. And frankly, the most important thing is that if you actually do start to develop symptoms, stop. If you're getting chest pain, stop. And if that chest pain doesn't go away, as much as we're dealing with an ER crisis right now, the most important thing you could do, frankly, is call 911 and go to the emergency room. Because if you think you're having a heart attack, time is really one of the most important issues.
And that's really one some people have to take serious, because it's mostly guys that probably shovel the snow, and mostly guys are terrible at going for medical help when they need it, right?
Right. I mean, there's an interesting thing is that outcomes are worse when people have heart attacks at home relative to when they have heart attacks in public settings. Because when you're at home, you say to yourself, "Oh, this is probably nothing. Maybe it'll pass. Let me wait. Let me see if it plays out." Whereas if you have a heart attack in a public setting, invariably somebody's going to call 911 the minute you start to have symptoms, because the cynical view is nobody wants to deal with somebody who's potentially having a heart attack. So it's completely understandable. People don't want to go to the emergency rooms right now because of all the stories they're hearing. It's completely understandable. And yet, if you're having a heart attack, one of the worst things you can do is wait at home, because the longer you wait, the more damage you are causing to your heart muscle if it really is a heart attack. And if it's not, the worst that's going to happen to you at the emergency room is you're going to get sent home. I realize that the delays are long, but nothing bad is going to happen to you if you have to go to the emergency room.
Absolutely. And let's talk a little bit. Let's bring the cold in now. I mean, we're seeing, especially out west, we're seeing some record low temperatures out there. What should people do who have to be outside?
If you have to be outside for an extended period of time, well, first off, try to limit that extended period. So, same sort of thing. Take breaks, go back inside, warm up, and come out again. A lot of people don't fully appreciate that, hypothermia is starting to set in until they start to get severe damage to either their vascular system or their neurological system. So take breaks, realize it's a lot colder than you think it is,
Mhm.
and dress warm. I mean, you lose most of your heat from your head. So wear a hat, wear a good hat, wear good gloves. But the most important factor is time exposure. Limit the amount of time that you're outdoors, because you don't have to do all the shoveling or all the outdoor activities in 30 minutes. You can do them for 15 minutes, then go back inside and then come back again. And that's really the best advice you can give people.
Yeah, at temperatures like this, the snow's not going anywhere, so you're not in a rush.
It's a marathon, not a sprint.
All right, doctor, thank you as always for your advice.
My pleasure. You take care.
Dr. Christopher Labos is an epidemiologist and cardiologist.